Great. Well, thank you so much, Anna, and good afternoon, everyone. And I just wanted to thank you all for inviting me here to give this presentation. I am a general pediatrician. I've been practicing for over 25 years, mostly in the Midwest in the US, and I recently completed a fellowship in integrative medicine through the Osher Center for Osher Collaborative for Integrative Health. And I'm just really happy to share a little bit more today on the applications of integrative health approaches in pediatrics. So I have no disclosures. And in terms of our objectives for today, my main objectives are really to sort of identify integrative approaches to pediatric care that we can use in our everyday practices, and also describe some specific integrative therapies that can be used for common pediatric conditions, and then just kind of show a little bit of how you can apply this integrative approach to specific pediatric conditions. So we'll kind of go over all of that today, and I welcome any questions as well. So just to kind of start with, I wanted to just define what is integrative medicine. And integrative health is really sort of bringing these conventional and complementary approaches together in a coordinated way. It really emphasizes these multimodal interventions, so two or more interventions, such as conventional healthcare approaches like medicine or physical rehabilitation or psychotherapy, and some complementary health approaches like acupuncture, yoga, and probiotics, and really using them in various combinations with an emphasis on treating the whole person rather than on one organ system. So that's kind of what we're talking about today. And I also wanted to make a little distinction between complementary versus alternative. So in the past, they've been sort of lumped together, but I think there's much more of a distinction now. And so if a non-mainstream approach is used together with conventional medicine, it's called complementary. But if a non-mainstream approach is used in place of conventional medicine, it's considered alternative. So what we're talking about today in integrative health and integrative medicine is really complementary therapies. And this is just a schematic diagram of how the National Institute of Health, their National Center for Complementary and Integrative Health, categorizes the different integrative health approaches. And you can see there's a lot of overlapping Venn diagrams here. So, you know, the natural products and the drugs overlap, nutritional approaches, mind-body practices include lots of different things, psychological approaches, meditation, breathing techniques, art, music, dance therapy, movement education, but also manual therapies and acupuncture. So you can see there's a little bit of overlap in these categories, which makes it somewhat hard to define, but this is just a schematic of how we think about the different types of complementary approaches as defined by the NIH. So, you know, what really are patients using? We know that people are using complementary therapies. I just wanted to share some data so that we have from the National Health Interview Survey from 2012. We don't have all the data from the 2022 survey, but what we know is that in 2012, 12% of children had used an integrative health therapy over the past year. And I was part of a group that looked at that did a national survey through our University of Wisconsin of about 2,000 parents across the country. And when we asked we asked the same question about how many parents had used an integrative therapy over the past year for their child, it was actually 32%. So we do know that it's increasing, and the most common conditions that children used therapies for in the 2022 survey that we did were to promote health, to increase energy, to reduce stress, to enhance sports performance, and to alleviate headaches. The survey also revealed inequities in accessing integrative health therapies, which I think is really important for us to consider as we move this forward and promote this work. But in the 2017 National Health Interview Survey, it was noted that non-Hispanic white children were more likely to have used yoga and chiropractic care than non-Hispanic Black children or Hispanic children. So I think we want to keep that in mind as we think about how we increase access to these services. So in our University of Wisconsin National Survey on Integrative Health, we also asked additional questions about parents' interest in learning about integrative health therapies and having their child receive integrative health services. And what we found is that about 65% of parents were interested in learning more about integrative health. And of those respondents who wanted to learn more, 75% wanted more information from their provider, and 99% wanted to receive those services within their clinic. You can imagine that that's kind of a much more convenient way to have those services. So really, this suggests that parents in the survey wanted their healthcare providers to be knowledgeable about integrative health approaches and were willing and wanting to receive these services where they receive their health care. And looking specifically at mind-body medicine, what we have seen is really an increasing trend to using integrative approaches and therapies, as well as specific increases in certain therapies like yoga and meditation. So from 2012 to 2022, you can see the increase in the use of yoga by children from 3.1% to 12.6%. And similarly, the use of meditation has increased from 0.6% to 7.1%. So definitely increasing over time. So what we know so far, based on the data of the national survey, is that there's an increasing use of integrative health in pediatrics. There's an increasing use of mind-body therapies, particularly with yoga and meditation. We know from the other national survey that a majority of parents are interested in learning more about integrative health approaches and therapies, and most people want to receive those services in their own healthcare clinic. But we also know there's health equity concerns. There's not equitable access to many integrative health therapies. So there is a framework. A lot of people think about, well, how do we know what therapies to use, or how can we evaluate therapies before we offer them to patients? Or maybe patients come to you and they're asking you, is this safe to use? So I just wanted to share different ways to think about how you can consider the safety and efficacy of different integrative approaches. Um, so when you're talking to patients about complementary approaches that they're using, you'll want to consider the efficacy of the treatment. Um, but so you want to know, is it effective? And then also the cost. Is it very costly? Is it worth the amount of efficacy that you're getting? And also the harms. What are the side effects? What are the effects of using this therapy and not using other therapies? And then the opinions or evidence base that you have, or evidence-informed recommendations. So, the evidence base for many pediatric complementary therapies is increasing, but for some treatments, the evidence base in children is not there yet. So we do need to consider expert opinion of those who've had experience. And in recommending different therapies, it's also, this is another way to kind of think about, it's kind of a common sense guide to balancing sort of the risks and benefits of making therapeutic decisions. So this framework can be helpful as well. Really thinking about, is the therapy effective and is it safe? And if it's both safe and effective, you can, feel fairly comfortable recommending that. If it's, not safe and not effective, obviously you want to discourage that. But if it's effective and not very safe, then you want to, monitor very closely or consider discouraging that and talking to the family about the risks. And if it's not effective but safe, you could talk to them about what you know about the evidence base, that it's not effective necessarily based on research, but it's safe. And if they want to try it and it's not harmful, you could consider using that. So this is just one approach to looking at how you might recommend these approaches. And I just wanted to kind of give an overview of pediatric integrative medicine in particular. And it's really the emphasis that we have in pediatrics, it's just really more expanded. So the emphasis, of course, on preventative health and lifestyle, but supporting the individual's innate healing response, I think, is really an important part, and focusing on that therapeutic relationship between patients and families and clinicians, and really considering health in all dimensions. So, mind, body, and spirit. And I think that's a little bit of a different way to approach things in our traditional training. But of course, very family centered, which is what we do in pediatrics, and using cultural humility, of course, and then using all appropriate evidence based therapies. This is a book by Dr. Hilary McClafferty, who's nationally recognized as a leader in integrative health in pediatrics, and very helpful book if anyone's interested. And then I just wanted to mention just a few approaches of how we could really kind of use an integrative approach in our own practice. One of them is really just honoring that therapeutic relationship and its impact on health outcomes. We're going to talk a little bit about how language impacts our approach, a little bit about placebo and nocebo effects, recognizing that what we say and how we say it really matters, and then thinking holistically about the care of children and adolescents. So, in terms of the therapeutic relationship, research really shows that the quality of the relationship between the provider and patients and families can really have significant influence on health outcomes. And there have been studies where they look at the physician's effects on the severity and duration of a common cold that when treatment was given through an enhanced or augmented clinical visit in which the clinician took time to create a real connection with a patient that was perceived as very empathic, there were better health outcomes for those patients. So just recognizing the relationships that we have and really using that to help patients heal, I think is really important. I think another really important thing is the kind of language that we use, and patients and families really remember um, what we say and how we say it. And it can really shape the experience of children. So, using positive language, praising their coping skills, those can be really important. And I just wanted to give an example of, a child, for example, getting an IV or getting amla cream. So, instead of saying, this is going to feel terrible, it'll just hang on, but really, so, kind of using positive language. So I'm going to apply some numbing medication now to your arm and your body to be more comfortable. And after this cream has been applied for a little while, we will place the IV. I'm not sure if it will bother you. Some people may feel a pinch or pressure. When we're finished, you tell me what you thought it felt like. And let's think about strategies to help your body relax. Do you want to listen to some music or do some breathing exercises? How about using some lavender to help your body relax? And then just a little bit about the placebo and nocebo effects. So many of us know that the placebo effects are those that are the beneficial outcomes that arise when we expect to feel better. And the nocebo effects are really, that's kind of characterized as the evil twin of the placebo effect. And it's really the harms that can arise from negative expectations. So in 2010, there was a study done at Beth Israel Deaconess Medical Center in Boston, and they wanted to explore whether the way in which a local anesthetic injection was described to a patient would influence their pain level. So they had a study where one group was told, you're going to feel a big bee sting, and this is the worst part. And the other group was informed, we're going to give you a local anesthetic that will numb the area and you will feel comfortable during the procedure. And those who were told that they would feel a sting, those patients receiving the negative suggestion reported significantly more pain after the injection, even though both groups got the same anesthetic. So, they really concluded that using gentler, more reassuring words could really improve patients' experience, especially during invasive medical procedures. And then just thinking about the whole child health, I think we do this fairly well in pediatrics, but this is from Stanford Medical Center, but it's basically thinking about the overall health and, sleep, diet, exercise are really important, but also, spirituality, social connections, the mind-body connection, all these contribute to mental health and well-being. So really thinking holistically about all the different things that can impact a child's health and well-being. So I was going to just talk about a few of the common pediatric integrative therapies that we use. Um, so these are a list of some of them that are commonly used in different parts of the country, both inpatient and outpatient. And I'm going to focus on the first two. So sort of mindfulness and clinical hypnosis, because they are, again, increasingly being used and I think can be really helpful to have an understanding of what they're like. So, mindfulness for children. So, really, what is meditation and mindfulness? Meditation has a history that goes back thousands of years, and many meditative techniques began in Eastern traditions. But the term meditation refers to a variety of practices that focus on mind and body integration and are used to calm the mind and enhance overall well-being. And some types of meditation involve maintaining mental focus on a particular sensation, such as breathing, a sound, a visual image, or a mantra, which is, repeated word or phrase. But other forms of meditation include the practice of mindfulness, which involves maintaining attention or awareness on the present moment without making judgments. And programs that teach meditation or mindfulness can combine these practices with other activities. So, some of you may have heard about mindfulness based stress reduction, which is a program that teaches mindful meditation, but it also includes discussion sessions and gives people other strategies to apply to stressful experiences. And then there's mindfulness-based cognitive therapy, which also integrates mindfulness practices with aspects of cognitive behavioral therapy. And I just wanted to share, this is a systematic review of current literature about the efficacy of mindfulness techniques used by mindfulness-based programs. And this is one that looked at the cognitive, socio-emotional, and academic skills of children 6 to 12 years of age. There were 29 studies that were eligible. Only 9 were randomized controlled trials, and the 20 were quasi-experimental. But what they found is that there is evidence that mindfulness can help improve cognitive skills and socio-emotional skills, and that was a reasonably strong association. But they found also that many of the randomized control trials did have a high risk of bias. So definitely further research is needed, but it is promising to know that it can impact cognitive and socio-emotional skills for children. And this is another study, school-based mindfulness research, um, another randomized control trial. And the goal of this study was to ameliorate the negative effects of stress and trauma among low-income minority middle school children in public school. So they had 300 public school children in fifth to eighth grade. There were two groups. One received health education and one received the mindfulness-based stress reduction 12-week program. And what they found is that the children who received the mindfulness-based stress reduction program had significantly lower levels of somatization, depression, negative affect, negative coping, rumination, self-hostility, and post-traumatic symptom severity. We know that there are many school districts around the country using mindfulness as part of their school curriculum. And these studies really kind of confirm the benefits and add to the evidence base that this could be a beneficial way to impact children's mental health. And I wanted to highlight this study, which was actually done and published in JAMA Psychiatry in 2022. And it was comparing the effectiveness of mindfulness-based stress reduction versus escitalopram for the treatment of anxiety. And this was a study done, it was a randomized control trial done with adults diagnosed with anxiety who were recruited at 3 US hospital sites in Boston, New York, and Washington, D.C. And in this study, one group received the mindfulness-based stress reduction. They did an 8-week class with 2.5 weekly sessions and 45 minutes of daily home practice. And the other group was treated with escitalopram, an SSRI or anti-anxiety medication, starting at 10 milligrams orally and then increased to 20 milligrams orally daily at week 2 if they tolerated it. And the main outcomes were a physician, clinician completed scale, and then a patient scale. And what they found was based on the statistics looking at non-inferiority, the two interventions were shown to have similar amounts of benefit. And so the authors were able to conclude that the mindfulness-based stress reduction intervention was non-inferior to the SSRI intervention. And I think this is very promising, and it may have implications for how we treat adolescents and even younger patients with anxiety. So, in looking at the mindfulness research trends in children, so what we've seen is, just to summarize, is that we've seen an increasing amount of research over the past 20 years and really positive outcomes in reducing stress, improving focus, regulating emotions, and self awareness. And research indicates that mindfulness practices can help children reduce stress and, can be very helpful, and especially in the early childhood. So there's a new early childhood focus and a growing interest in incorporating mindfulness practices at the early ages, recognizing the potential benefits for young children's development. And then, brain development implication studies are really exploring changes associated with mindfulness training in children and the potential positive impacts on brain regions that are related to emotional regulation and executive functioning. And in terms of clinical applications, mindfulness interventions are really being investigated as tools to support children with challenges like anxiety, ADHD, and behavioral issues. But definitely there's a need for further research. So while this trend is promising, researchers still need to further explore the most effective mindfulness techniques for different age groups and develop robust long-term studies on the effects of mindfulness practices in children. And so, a recent review article kind of summarized the research, suggesting that mindfulness may lead to improvements in emotional self-regulation, attention, self-esteem, and self-acceptance. And this can be really useful for conditions such as anxiety, um, acute and chronic pain, depression, ADHD, school stress, conduct disorder, and sleep disorder. And if you think about it, for those of us who practice general pediatrics, this is a lot of what we see. And so this is very exciting. And in the future, it could really have significant impact on the physical and mental health of children. And I just wanted to share a few techniques. This is a technique I use with children and families all the time in my office, and I'm sure many of you have been doing or know some of these techniques. But this is really where you inhale for a count of 4 and exhale for a count of 8. And you can do this with a count of 3 to 6 or any 1 to 2 combination that feels right. But the key is to do this several times, and it can be a really incredible way in the moment to bring your body towards a state of relaxation as we activate the parasympathetic nervous system. So, the tracing of the hand is commonly used with young children as sort of a fun way to count the number of breaths without actually having to count them. So, kind of inhaling as you trace your finger up your thumb and exhaling as you trace it down, and then really taking 5 deep breaths by tracing all the fingers of your hand. Um, Another really grounding breathing technique is square breathing. So, where you breathe in for a count of 4, hold for a count of 4, breathe out for a count of 4, and hold for a count of 4. And this can really help, again, calm and regulate the nervous system and help the body cope with stress. It just brings more oxygen to the body. And sometimes this is very helpful to do in the room with patients while you're there. And I do this when I have learners in the room too. So the parents are doing the breathing as I'm teaching the child, and the the medical student or resident is doing it too, and I'm doing it too, and it's can be very helpful. Um, and then this is another grounding technique. It's called the five senses grounding technique. So really, if kids are feeling out of sorts, sort of taking this is a way to sort of just have a little bit of a kind of a break and to be able to reset, having them think about five things they can see, four things they can feel or touch, three things they can hear, two things they can smell, and one thing that they can taste. And other resources I recommend for families, Mindful Powers is a kind of a holistic app to kind of build socio-emotional learning through the power of play. Smiling Minds is a tool developed by psychologists and educators, and it uses mindfulness and positive psychology strategies for children. Many of you are familiar with Insight Timer, and that also has like guided sleep meditations and other resources for parents and children. And then Sesame Street has the Think, Breathe, Do app, and that's a research-based app that teaches children how to calm down and be able to solve everyday problems. And then there's a couple websites, Hey Sigmund and Mindfulness for Teens, which can be helpful too, that have a lot of great resources. So if you're looking for ways to support the use of mindfulness for patients, I think it's reasonable to support and encourage patients who are interested in trying mindfulness or meditation because it can be helpful for anxiety, sleep, negative thoughts, and a variety of medical conditions that are triggered by stress. Sometimes it's helpful to try things out yourself if you haven't already, but there's lots of apps out there for adults as well as websites and many courses in the community. Referring to a local mindfulness program for classes, we have a University of Wisconsin mindfulness program, and so they offer classes for teens and children and families, so that's been helpful. And then consider incorporating it into your treatment plans. And I think whether you're in general care or specialty care, it can be really helpful. So I wanted to just also touch base on another common pediatric integrative therapy, clinical hypnosis. And just to talk about what hypnosis is and what it's not. So it is not stage hypnosis, which some of you might be familiar with from the movies. But what it is it's really guiding people into a focused state of awareness that helps them gain mental or physical control over their thoughts, behaviors, or actions. And hypnosis does not work for everyone, although everyone has the potential to benefit from it. But you do need to be willing and able to focus your attention and follow the suggestions of a therapist. And contrary to popular belief, you cannot be hypnotized unwillingly, and you will not follow directions against your wishes. Um, but it's really, engaging in this hypnotherapy can lead to high attentiveness and receptivity to suggestion. And these positive suggestions can access that subconscious mind and can help retrain the brain. So it can help with coping skills. It can help with developing new pain management strategies. Um, it can also help people in reprocessing important sort of psychodynamic emotional factors that are contributing to their symptoms. So hypnosis can be used for a variety of different conditions. It's often used for procedural pain and anxiety, headaches, abdominal pain, and other pain syndromes, tics or habits, pulmonary symptoms, nausea, enuresis, insomnia, difficulty with taking medications. Um, and again, the way it works is it's kind of that self-regulation of the mind-body connection where the child is in control and the child uses their imagination to make changes in their thoughts, feelings, or behaviors. And there's very specific language that's used in when you learn clinical hypnosis. There's a technique and there's specific imagery and specific language that is used in the whole process. And the clinician just serves as a guide, a coach, or a facilitator of the experience. So This is just a randomized control trial of hypnotherapy with for children with functional abdominal pain or irritable bowel syndrome. And what this was a study in which 53 patients aged ages 8 to 18 were with functional abdominal pain or irritable bowel syndrome, and they were randomized to either the hypnotherapy group or the standard medical treatment group, and having 6 sessions over a 3-month period. And then they looked at outcomes like pain intensity, pain frequency, and other associated symptoms at baseline, during therapy, and then 6 and 12 months after therapy. And what they found is that the pain scores decreased significantly in both groups. However, the hypnotherapy group was highly superior with a greater reduction in pain scores compared with standard medical treatment. And at 1 year follow up, successful treatment was accomplished in 85% of the hypnotherapy group and only 25% of the standard medical treatment. So, the authors concluded that really gut-directed hypnotherapy is highly effective in the treatment of children with long-standing functional abdominal pain or irritable bowel syndrome, and that these effects are sustained at 1 year. And, actually, the American College of Gastroenterology includes the recommendation to consider using gut-directed hypnotherapy in its 2021 clinical practice guidelines. So it's starting to become a little bit more mainstream. I just wanted to mention, if you're interested in learning more about this, the Hypnosis with Children is a great reference book for if you're doing clinical hypnosis. But if you want to learn a little bit more about this, the National Pediatric Clinical Hypnosis Training Institute in Minneapolis is a great place to, take. I think there's webinars you can go to, but I've done their workshops where you get certified to do clinical hypnosis, and they're really high quality and excellent teaching there. So, how can you support the use of hypnotherapy, even if you don't are not trained or don't want to get trained? But just staying open to the possibility of using this when patients express an interest in this as an adjunctive treatment for a variety of medical conditions, and referring to providers that are trained in this technique if families are interested. And then there is an app that is called Reverie Self Hypnosis that can be used for folks, especially if you have patients with, like irritable bowel syndrome. It's not free, so you do have to pay for it, but it can be very helpful. And so I thought I would just do a quick case of how you would maybe think about an integrative approach to different patient conditions. So this is a case of a 16-year-old high school cross-country junior runner. Um, she's got headaches for the past several months ever since school started. They're dull and achy, last a few hours every day or every other day. She worries a lot about her sports performance because she's hoping to get a scholarship at her local state college, like her state school. And this is making it hard to fall asleep at night. So she's also a perfectionist, and she's taking several AP classes. And so she comes to you as your pediatrician, and she asks, what can she do for these headaches? A family friend recently tried acupuncture and recommended it, so she's interested in finding out more about that. So, additional information: her parents are divorced. She lives with mom and dad, each 50% of the time. She's a high school junior. She has a 3.8 GPA. Her activities are cross country and track. She denies substance use, denies being sexually active, and denies thoughts of suicide. And her GAD, her anxiety screener, is pretty significant for significant anxiety, and her depression screener is sort of mild, her PHQ-9, and her exam is unremarkable. So, sort of thinking about tension headaches and what an integrative approach, we can definitely think about that, especially because she really has this history of stress, anxiety. She's a competitive athlete and a perfectionist. She's taking challenging courses, having trouble falling asleep, and she has an interest already in trying some complementary therapies. So, in terms of thinking about, what else we can do for her besides sort of Tylenol or ibuprofen, really thinking about nutrition, making sure she's having whole foods and that she's having adequate hydration, that she's not skipping meals, which is not uncommon, of course, in high schoolers who are busy. Optimizing perhaps omega-3 fatty acids, vitamin D, making sure she is not anemic. Thinking about supplements like magnesium, coenzyme Q10, and B2, making sure she's getting adequate sleep and adequate rest, no screens an hour before bedtime, all that kind of sleep hygiene that we recommend for kids. And then expanding our toolbox into whether some other mind body therapies that could be helpful for her. It's not going to be the same for everyone, but if patients are interested, sometimes it can be really helpful to do meditation regularly or to start doing some yoga or progressive muscle relaxation to help her sleep at night. Definitely, cognitive behavioral therapy, referring to a behavioral health therapist can be helpful. And if she's interested in trying acupuncture, I think referring to a local specialist is a great idea. You want to make sure you're referring to somebody who's certified and who's qualified. But other options include osteopathic manipulative medicine. So if you have providers in your community who are doing that, that can be also really helpful. And I just wanted to shift gears a little bit to talk about some resources. The American Academy of Pediatrics has a section on integrative medicine that I'm a member of, but they put out, you know, resources, and this is a clinical report on kind of an overview of pediatric integrative medicine. So if you're interested in learning more about that, this is a great resource. I mentioned Dr. McClafferty's textbook, but if you're just interested in integrative medicine in general, this is sort of the big textbook that David Rakel and Vinnie Miniacello wrote this textbook and edited this, and it's sort of the foundational book for all integrative medicine fellowships. Um, and I think that most of you probably know about the Healthy Plate, but there's the USDA Healthy Plate and then there's the Harvard Healthy Plate. And I give this resource out a lot to families because it's really a little less industry sponsored and more science and research based, but it's a great website with lots of recipes and great child friendly activities and information for families. And then this is the Natural Medicines database. Some of you may be familiar with this, but just if you haven't been familiar, it's oftentimes free if you have are affiliated with an institution that has a subscription to this. But it's a great way if people are coming to you and asking, is this a safe herb or supplement or medication to take? You can see how it interacts with other medications. You can see if it's efficacious, what are the side effects. So it kind of gives you some more tools in which to kind of address the concerns of families. And then if you go to the NIH website, the National Institute of Health, Complementary and Integrative Health, they have a lot of information on here as well, including these, health topics and herbs at a glance, information for healthcare professionals. And if you go to the herbs at a glance, you can kind of look at these different herbs and click on the hyperlink of the herb and kind of find out more information about it. Again, some of the potential side effects, what the science says, and then that kind of thing. And so, in general, then, I just wanted to kind of summarize that there's really increasing research to support the use of integrative therapies. And we really can take this whole child approach to the care that we give in general pediatrics. And just remembering that language matters and how we say things is really important because people will always remember how you made them feel, like that Maya Angelou quote, and then we do have many complementary therapies to help patients. So, really being able to open up and expand our toolbox can be really beneficial for families. And there are many, clinician and patient family resources that are available. So I just wanted to thank you all for allowing me to share some of this information today. I have a few references here and then some post-presentation questions.
Thank you so much. I always feel like just calmed even after hearing about all the integrated services. Shall we go over the post-session questions first and give everyone a minute to answer those? And then I see some questions coming into the chat, so we have some time to answer those after we do our post-session questions, I think. Always so fun sitting on the other end of that quiz and seeing the numbers pop up for who chose what. I wasn't sitting on that end today, but when I do, it's fun to watch, especially if people are getting the answers right.
Yeah, we'll give everyone a minute or two more. We're just about a 40% complete. Well, not quite halfway.
There's no rush.
Okay. Oh, there we go. I think we can end that now. And let's see. Oh, could you go over, looks like probably all of them.
Okay, yeah, for sure, for sure. Um, so yeah, so hopefully this wasn't too tricky. I know some of these were kind of like which one is not correct, but so the first one, integrative medicine can be defined by the following statements and which one is not correct. So we're looking for the false statement. And the first three are true. So the essence of integrative medicine is that brings conventional or complementary approaches together. It's true that integrative health emphasizes multimodal interventions, and that the approach of integrative health involves coordinated care. The one that's not true is that the focus is on one organ system. So I know that was a little tricky sometimes with the wording, but it looks like half of you got that right. So yep, that's number one. And then the second one, nocebo effects can be defined as, and the answer is C, the harms that arise from negative expectations. Um, and looks like the majority got that one correct, so that's great. And then number three, all of the following are current research trends in pediatric mindfulness research, except and the answer is B, that there is conclusive evidence that mindfulness can improve anxiety and ADHD. There is suggestion that that is true, but we need more research to confirm that. But I think this was the one that was tricky because all of the rest of them are true. So research has been increasing over the past 20 years. There's an early childhood focus, and positive outcomes may be noted for children who use mindfulness in reducing stress, improving focus, and regulating emotions. And then number 4, um, clinical hypnosis is characterized by which of the following statements? And most of you got that one right as well. Positive suggestions allow access to the subconscious mind to retrain the brain. And the last one is that clinical hypnosis is not beneficial for children with irritable bowel syndrome, but the research is showing that actually it can be beneficial. So yeah, so I hope it wasn't too tricky, but I think everybody did pretty well, and I'm happy to take any questions.
Thank you for going over those answers. I definitely think I got one of them wrong. But it keeps us on our toes, especially around lunchtime, which is good. So I do have one question from Dr. Weary. He is saying, it appears to me that a certain degree of maturity is needed for effective mindfulness programs. It's certainly appropriate for teens, but could you comment on a lower limit of age,
Mhm.
basis on your experiences and kind of what you've seen in the literature?
Yeah. Yeah, that's a good question. So, I would say a lot of the research on mindfulness has been done in adults, but then most within pediatrics has been done sort of on the older age group. So I agree that a certain degree of maturity is needed. Um, there are programs out there for middle school kids as well, and the research that I've seen is mostly on kids sort of you know 10 and over kind of, but I agree that you know there may be more research coming up for younger children, but we don't have all of that yet.
Do you know if there are studies being done right now in certain age groups or?
Yeah, I mean, I'm actually working on developing a mindfulness-based group medical visit for children with anxiety, sort of tweens, so sort of the like 8 to 11-year-old age group. So, um, there may be some research coming out of that. We're going to be looking at anxiety, looking at a baseline, and sort of after the 4-week group medical visit. So I think we're starting to examine that, and again, it's really just building on what we know so far. But I agree that there's been less of the research on the younger children for mindfulness.
And in general, we know it's always challenging to do research on the younger children, just in general, no matter really what you're looking at. I'm so
Mhm.
happy to hear that we are looking at these integrative approaches more in pediatrics to begin with, but especially in the younger groups, the younger age groups as well. Are there any other questions? Feel free to put them into the chat, or you can unmute yourself as well. If anyone wants to share their lovely voices. Otherwise, I can let people go a little bit early, perhaps in that case, and let everyone get back to work. Oh, I'm seeing a comment here. Oh, interesting, Jennifer. So she says that she's used mindfulness strategies with younger kids 5 to 7 years for allergy shots or injection therapies for asthma with to help with the needle phobia. That's
That's great.
amazing.
Yeah. I wonder, Jennifer, if you could share a little bit about what you've been doing or what you've been using.
Oh, hopefully you can hear me. So I could learn some really great strategies from a child life specialist. And I mean, recognizing the fact that it's not necessarily directly linked to the pain itself, but the anxiety about receiving an injection. And so being able to have the child have a comfort item or a grounding item that they focus on, while also utilizing like distraction therapies like the Buzzy Bee, because the distraction therapy or treat, like, you know, the Buzzy Bee alone, while it'll distract the pain of the needle, it's not removing the anxiety that is building up in the child. And, you know, for a lot of these kids, once they get over the needle phobia and they realize that it actually isn't that painful, and they continue to bring their comfort item, their grounding item, have actually had some good success with these young kids who they really do need the injection therapy. And yeah, before too long, they're, you know, they're like the big kid in the clinic, try and help the other little kids, be like, hey, it's not so bad, you just need to bring your teddy bear or your lion, and you focus on that. And oftentimes it also helps the parents to also understand that the child oftentimes will feed off of their anxiety, and so ways for the parents to not further contribute to the child's needle anxiety. And so it's just kind of like a really nice way to provide non-medications to help that child overcome their needle fears.
That's wonderful. Yeah, it's great. And I love that you're working with Child Life and really sharing techniques and working with parents too, because it is really important. There's so much self-regulation that happens between parents and children, and especially if they're coming in for multiple, um, you know, injections for, you know, immunotherapy or something. So yeah, thanks for sharing.
Yeah, absolutely. And that really is such a good point. You do need to really include the parents so much in really all of those process. Definitely something we see on the inpatient side a lot, just considering the high stress situation that everyone is under there as well. And that feeding energy that can go in either direction, right? Thank you so much for sharing. Thank you everyone for joining. I will let you all go. Thank you so much. It was such a pleasure meeting you. Our next session is going to be on the 6th of November. It's going to be Dr. Yamauchi, one of our cardiologists at Kapilani, who's talking about arrhythmias. So hope to see you all there. Thank you so much for joining. Any last minute questions or thoughts? I'm seeing mahalos coming in. Thank you so much again.
Thank you for having me.
Awesome. Thank you, everyone.
Mahalo. Thanks,
Summer.
everyone.
Thank
Next time.
you.